I want to share this short video to remind you of what we talked about during our initial meeting for Capstone and to summarize aspects of contacting your preceptor, preparing for your first clinical day, and what to focus on during that first clinical day. You'll only have 10 days, so we need to make the most of each day in Capstone. The most important thing that you can do to prepare for your first clinical day is to get a good night's sleep or a good day's sleep, regardless. Do get a good sleep before your first assigned shift. Being on your feet in a stressful situation for 12 hours on a unit is a little different from a very controlled few hours for a clinical day. So rest so that in essence you do your best. Beforehand, review or find access to handouts from your previous courses listing normal lab values, medications, diagnoses, treatments for those conditions that you know you will see. Review basic skills. There is a S2 skills list in the preceptor's packet. Review that to refresh yourself on some skills that you may not have done. Those of you at Dell, spend some time to review developmental milestones. Remember to have your uniform and shoes clean, patched, shoes stains removed, whatever else is necessary. Remember your UT student badge. Remember that you must have your nails trimmed, tattoos covered, your hair away from your face and pulled back at all times. Clarify your work schedule with your preceptor. Know exactly what time to report, what to bring in terms of personal equipment. Ask about meals. Do staff normally have time to go to a cafeteria, or is the cafeteria even open during your shift? Should you bring a lunch? What resources are available? What's the general routine about meals on the unit? Confirm where to park. Make certain that you park where you are told to do. Know how to access the unit. Most of these units are locked units or closed limited access units. You will need a badge, barcode, or some other ID. You must have your UT ID at all times. You will also have an agency badge. I am still waiting to hear back from Round Rock about your student badge there. When I know something, I will let you know. Ask your preceptor about policies regarding personal electronic devices, about personal phones, sending and receiving personal messages. Now, a text or phone message to me about Capstone is not a personal call, but do remind your family and friends that you are now working as a nurse, and personal calls must be limited to extreme circumstances and taken only when you are on break or a lunch. Ask your preceptor about the most frequently seen types of patients or diagnoses or conditions or meds. That will give you an overview and a heads up on what to review in the next few days. When you have your schedule for at least the first 3 or 4 shifts, notify me via email of that schedule. And even though I have met with your preceptor and checked everything out beforehand, there are always some situations that we need to deal with. Schedules change. They will really change that week of Thanksgiving, so prepare to be flexible. When I say be prepared for your first clinical day, I mean be on time, ready to go at the assigned time. If the shift starts at 06:45, then you are there on the unit with your clipboard raring to go, hands washed by 06:42. You are not simply pulling into the parking lot at 06:45. So be prepared, be on time. Day 1 will primarily be a shadow day. You will probably not have full Compass or Meditech access, so don't plan to give meds on your first day unless you and the preceptor agree that that's acceptable and the preceptor is willing to complete documentation, because you will probably not have access. During the day, make certain that your badge works to access nutrition rooms, linen rooms, treatment rooms, med rooms, whatever. If your badge does not work, your agency student badge, you'll need to notify security to reprogram the badge. Your names have been sent to the agency, indicating that you will need access to these specialty areas, but that information may not have filtered down. If you have questions, call or text me. Also, try to do a scavenger hunt of sorts. Use the scavenger list from your previous courses. Sometimes they will have scavenger lists for new employees. Ask your preceptor about that. But find the supplies, treatment equipment, know where things are kept so you can access anything quickly. Spend time reviewing equipment in the treatment room so you can find that equipment quickly if it's needed during the procedure. Locate the crash cart. Check with your preceptor regarding emergency evacuation procedures. Know the fire procedures. Know where specialty equipment is kept. Review your room to see what emergency equipment is kept at the bedside and on the wall. Those of you in ED and in labor and delivery, mother, baby, know what emergency equipment is kept there in the room, know what is on the wall. Activate the equipment, work with the beds, work with the O2, work with the suction, become familiar with it early on that first day. I will visit during your first clinical day. During that time, I will pick up the preceptor information form, and we will review responsibilities form. So keep all forms with you until your first day, and then I will pick them up. During our first meeting, I will review the potent medication list with the preceptor, what medications you cannot give, blood products, chemotherapy. We'll talk about insulin administration, heparin administration. Those of you at Dell will talk about this, giving meds through a central line and a PICC line. Dell is different from what students are allowed to do with central lines. I will also review the documentation requirements, and we'll see what is feasible in your situation. We'll have an understanding about what can be done in terms of a preceptor illness or a change in schedule. And again, each unit is a little different. We'll see what the options are, but please do not worry. We will ensure that you're able to complete your 120 hours required for Capstone. Do have my telephone number programmed into your phone. Feel free to call or text for questions. And certainly if your schedule changes from what you previously gave me, or in the event of a critical incident of some kind on the unit. Do not use the faculty on-call list. Remember to call or text me regardless of the time, situation, or who is listed on the faculty on-call list. From your second day, be prepared to call my office to give a verbal telephone change of shift report for one patient. My faculty number is area code 512-232-8264. You'll need to plan to give verbal change of shift reports for your first 2 clinical days. Use the guidelines that I gave you during the orientation. You may practice that shift report. Please do practice it so that you will have it limited to no more than 10 to 12 minutes. You may call either while you are on the unit, but please do not tie up a phone when other people are giving voice care or other verbal change of shift reports. If you decide to do it at home, please make sure that you do it within the first 2 hours after the end of the shift. When the first few clinical days, talk with your preceptor and charge nurse about how to meet the leadership objectives. We'll explore how to schedule those planned activities. And when I visit, we'll talk about how to, in essence, complete those leadership management required. Every clinical day, plan to keep a record of the time. Have your preceptor initial it every day. Keep a clipboard or a notebook or something with you on the unit so that you would have a copy of the syllabus and can refer to the potent medications list. You can keep your time log there. Remember to keep a blank sheet over the clipboard. Remember HIPAA regulations. Remember, you cannot make a copy of any patient record for any reason at any time. Every day, I would encourage you to have specific objectives for what you want to accomplish for that day. Share these objectives with your preceptor. When I visit, I will ask how well you're able to meet those objectives, and we'll make plans or assignments accordingly to allow you to, in essence, meet those, your personal objectives. I would encourage you to practice clinical reflection of what you did, how you identified, how you solved clinical problems. Do that each day. Spend some time after your shift is over thinking, what did I do well? What did I do not as well? What can I do better at my next shift? Remember, this is your experience, so plan for it so that it, in essence, will result in what you need and what you want. We will do a mid-semester evaluation during your 5th shift to help plan for the remaining shifts to ensure that, in essence, you complete all objectives. Some general details. Remember that if your preceptor calls in ill and you are there or are making your way to the unit, call or text me and we will see about an alternate preceptor for the day. If your preceptor notifies you that she will be canceled for the day and you want to work that particular day, contact me. We'll see how an alternate preceptor can be identified. And remember, you cannot move with your preceptor for a vertical change, that is an increasingly acute or a higher acuity level, but you can move with your preceptor on a lateral transfer from one unit to a comparable unit. And we'll explore this with the preceptor during our first meeting too. I would encourage you to remember that you are, in essence, interviewing for a nursing position every time. You are on the unit, in the cafeteria, walking across the parking lot. Most professional positions are obtained through networking, and nurse managers and employees are looking all the time for quality in patient care, individual appearance and concern and conduct, and personal integrity. Remember, you represent nursing, and the University of Texas at Austin School of Nursing. Make certain that at all times you represent yourself, nursing, and the school proudly. And plan to have a great time. This is a marvelous, exciting opportunity. We will all be available to help you maximize every possibility to ensure that it is a beneficial learning experience for you. So please call or text if you have any questions at all. Thank you.